class, my name is Jasmine, and I did my research paper on a comprehensive view of vaccination research and policy. The vaccines date back thousands of years to the 1500s, where the first evidence of inoculation was found in China and India. Even though this was centuries ago, it has been a very slow movement to gain traction. It has remained very controversial. In 2007, the celebrity Jenny McCarthy appeared on Oprah claiming that her son's autism was caused by his MMR vaccine. Her message was estimated to have reached 15 to 20 million viewers. And in the years following her appearance, the effects of her words have been enormous, and the anti-vaccination movement has had an influx of members. So her announcement was kind of influenced by Wakefield's 1998 report that was published in The Lancet. He hypothesized that there was a correlation between autism and the MMR vaccine. So he hand-selected 12 children with gastrointestinal disorders to perform the study, and noticed that 8 of the 12 children started showing symptoms for autism sometime after receiving the MMR vaccine. And there was a number of things wrong with the study, such as a very small sample size, in addition to hand selecting the children in order to show favorable results for his hypothesis. But it wasn't retracted until 2010, even though there's been ample research done to correct his findings. For example, in 2004, the U.S. Institute of Medicine conducted research to refute his results and found that while some studies did have an increase in the reported cases of autism, this was more so due to improved research and diagnostic grasps of autism that eventually led to more children being diagnosed coincidentally at ages after the MMR vaccine. And so we'll see here some data regarding a population study between MMR and autism. And this table shows the association of certain variables related to the vaccine and the risk of autism. They calculated the relative risk with adjustment for age, sex, birth, and various other factors, and found that overall there was no increase in the risk of autistic disorders or other autistic spectrum disorders among vaccinated children or unvaccinated. And so the repercussions of Wakefield's report have been stupendous. And you'll see here that there has been an outbreak of measles in the UK and Wales from 1998 to 2002 onwards that showed a very significant upwards trend, leading to an outbreak of over 2,000 cases in 2012. And so currently in the United States, all 50 states allow for medical exemptions and 47 allow for religious and/or philosophical exemptions. Vaccine exemption policies at the discretion of the states. And there's been research done by Bradford and Mandic that has proven that states with stricter exemption policies have statistically significant lower numbers of exemptions. They found that on average, requiring state health departments to approve exemption applications have a 1.12% lower exemption rate than states without that said policy. And here it shows the results of their research. And you'll see that for certain components of vaccine exemption policies, such as standard forms or scalable requests, having health departments requiring to approve non-medical applications, or having criminal or civil penalties to induce compliance, all have statistically significant results on the rate of exemptions. The increasingly worrisome proportion of parents who do not vaccinate their children is accompanied by a government administration that is also skeptical regarding the effectiveness of vaccines. In the past, President Trump and Education Secretary Betsy DeVos have both been reported to have voiced their concerns over the supposed correlation of vaccines and autism. However, in the past year, the government administration has been shifting their perspective, with President Trump even publicly announcing that vaccinations are incredibly important. And this has been in light of the recent measles outbreaks in the United States, where the number of cases has surpassed the highest number on record since the CDC declared it eliminated in 2000. This change in standpoint is very hopeful for the future of vaccines in the U.S., with former Food and Drug Commissioner Scott Gottlieb, even raising the perspective of federal intervention. And so there's a number of ways that federal intervention can occur. First, they could utilize their authority given by the Public Health Service Act of 1944, specifically Section 361. So this act essentially established the government's quarantine authority and authorizes the U.S. Surgeon General to make and enforce regulations that are necessary to prevent the transmission of communicable diseases. However, the main issue with this is that this act specifically prohibits any regulation that would supersede state law. The second course could be Congress creating legislation mandating immunizations that would supersede state laws. However, this has been attempted fairly recently in 2015 with the Vaccinate All Children Act that didn't even make it past the House Health Subcommittee. And this would, in theory, require all states to mandate vaccination recommendations by the CDC with the threat of withdrawing federal funds in the case of noncompliance. However, we have historically seen that this is very implausible. The third and most plausible course of strategy is increased recommendations to tighten vaccination policy by the CDC. So this is what the CDC did in the 1960s, where the measles outbreaks were found to be originating in school settings. And they strongly urged states to constrict their school entry vaccination requirements and found that within a decade, 50% of states had school entry limitations, went up to 100% of the states. And so vaccinations from a policy context play an essential role in cost effectiveness. And extensive research has been done in this field as well. A report by Nickel in 1994 performed research on the cost effectiveness of the flu vaccines in regard to the elderly. They studied 3 flu seasons from 1990 to 1993, each season including over 25,000 people. So we'll see here that this is a very large sample size. And they found that on average, receiving a flu vaccine led to a statistically significant 48 to 57% reduction rate for hospitalization due to influenza or pneumonia. And the cost of hospitalization for all illnesses found and tested were lower with the flu vaccine. This translated to direct savings per year that averaged around $117 per person vaccinated, leading to cumulative savings of nearly $5 million in the study alone. So this research proves that within this focus group, vaccinations were extremely cost effective. And here we'll show a table with their results. And you'll see that for a majority of the characteristics, the p-value is less than 0.0001, showing that the results are very statistically significant. In conclusion, there has been extensive research performed over the years that certify the safety and effectiveness of vaccines. And in light of the number of measles outbreaks recently, the U.S. Federal Administration has been improving and tightening their viewpoints regarding vaccinations. The most plausible method of the ones discussed previously is most likely increased emphasis and urging from organizations such as the CDC for states to tighten their vaccine policies. Ultimately, vaccines are incredibly cost-effective at limiting disease, and policies regarding vaccines should thus be taken very seriously.